Health, yeah. This isn't your average health talk. We're asking those awkward questions for you. We're digging into the health, wellness, and medical news that matters to you. We're cutting through the clickbait with facts you can trust, from uncomfortable questions to breakthrough science. It's a dose of real news you can use. This is Health Yeah with Monica Robbins, your prescription for life.
They ease stress, calm anxiety, and chase away loneliness, all while keeping us active and connected. Pets are good for our health, as long as we're keeping them healthy too. Coming up, they're easy to spoil, but keeping your pet in shape may be the greatest act of love you can give. And what every large breed dog owner needs to know, the life-threatening condition that took my own dog, Griffin. Plus, 1 in 3 pets will go missing. Most reunions happen quickly, but after 24 hours, the odds drop fast. Experts share how you can improve those odds. Hello, I'm Monica Robbins. Welcome to a special edition of Prescription for Life, dedicated to our pets who enrich our lives and make them better. This is also a Clear the Shelters episode. Clear the Shelters is a month-long August campaign by NBC Universal aimed at getting shelter pets into their forever homes. Since 2015, more than 1 million pets have found their forever homes thanks to this effort, and millions of dollars donated to local shelters. NBC stations are proud partners of Clear the Shelters, and we're featuring local pets and shelters all month long, on air, on streaming, and online. Head to cleartheshelters.com to find shelters near you and learn more about this campaign. So why are we doing this? Because science shows pets are good for our health, both physically and mentally. But that gift comes with responsibility, making sure we're meeting their needs. That means keeping vaccinations up to date and protecting them from parasites like fleas, ticks, and heartworm. Those are just the basics. Giving our pets the best lives often starts with what and how we feed them. Pets come in all shapes and sizes, but sometimes we love them a bit too much and overfeed them and their size gets out of hand. It's such a big problem. Nearly 6 in 10 dogs and cats in the U.S. are overweight or obese. What's worse, it's a life-shortening health crisis that can steal up to 2.5 years from their lives. This is why we need to love them with exercise, because that helps, and it helps us too, and keeps both of us healthy.
Oh, to be the fat cat where you roost, or the big dog in the neighborhood. Yes, we may worship the ground they walk on, but we're not doing our pets any favors overfeeding them.
Having a healthy, lean body weight is the best thing you can do if you want to keep them around as long as possible.
Your pet is overweight if they tip the scales at 10 to 20% over their ideal weight. 30% or more, they're considered obese. Dr. Chantel Ragu is an internist at VCA Great Lakes Veterinary Specialist in Warrensville Heights. She sees pets that are pretty sick. Too often, they're serious conditions brought on by their weight.
They've done studies on tens of thousands of dogs, at least, that have shown that you can shorten their lifespan up to 2.5 years if they're severely overweight.
We're talking a whole host of ailments, including heart disease, diabetes, some types of cancer, and more. So how can you tell if your pet's at risk? Dr. Ragu walked us through the steps on her own dog, Iggy.
The best thing you can do that is the most subjective is to feel over their ribs, and it should feel like the back of your hand. It should feel there's a little bit of covering and tissue over the ribs if the knuckles are basically each rib. You obviously don't want them to be this bony, but you don't want them to feel like the inside of your palm where you can tell that there's too much meat and fat overlying the ribs. So just kind of feeling the ribs, making sure that they have a nice little tuck on their belly is the easiest thing you can do at home.
If after that home exam you think your pet is plump, Your next step is to contact your vet. They'll help you formulate a good weight loss plan that's balanced, lower in calories, but still has all the nutrients they need. And a word about treats. Dr. Raghu says for all pets, they should be no more than 10% of their daily caloric intake. They may not like it, but in the long run, it's worth it.
They're going to feel more comfortable, right? They're going to feel more playful. They're going to be able to jump up on the couch and snuggle with you again when they weren't able to before. They're just going to feel so much better.
Along with waste management, there's another health issue we share with our pets, aging eyesight. While we can share changes with our doctor, our pets cannot. But there are ways to ensure their eyes are in good health. Carmen Blackwell reports.
Those sweet puppy dog eyes, they'll melt your heart. And just like the rest of your pet, those eyes are deserving of tender love and care.
Okay, Iggy, you ready?
That brings us to VCA Great Lakes Veterinary Specialist in Warrensville Heights for a chat with Dr. Parker Wilcox. As a veterinary ophthalmologist, he examines and treats any condition or disease relating to the eye, eyelids, or eye orbit.
Your primary care veterinarians are looking at your animal's eyes as part of their whole physical examination. Once they start to identify things or we're actually seeing issues, they'll typically refer to a veterinary ophthalmologist for a more extensive workup.
Among the most common conditions he sees, dry eye, which is a lack of sufficient tear production, corneal ulcers, a condition where the outer layer of the eye erodes, and lastly, cataracts. Senior dogs are at the greatest risk, and treatment for cataracts requires surgery.
I wish there was an easier way with just medical management, but it also allows us to restore vision to animals so that they can have a good quality of life moving forward.
Dr. Wilcox walked us through an eye exam on Iggy. He checks everything from the cornea all the way back to the retina and the optic nerve. A check of tear production and eye pressure to gather as much diagnostic information as possible.
If you're beginning to see clinical signs at home that you're concerned with, increased redness, tearing, squinting, discharge, or changes in vision, having it addressed earlier is always better than waiting.
And yes, just like us, our pets can suffer from seasonal allergies, leading to itchy, watery, irritated eyes. A minor nuisance, but still very important to get checked out.
Just to make sure it's nothing more serious before we just, start utilizing allergy drops or eye relief drops.
By taking care of your pet's eye health, they'll stay happy to see you for years to come.
Good job.
Did you know there's a connection between eyesight and weight? 75% of dogs diagnosed with diabetes will develop cataracts within the first year. Now, when was the last time you brushed your pet's teeth? Will they even let you do so? That stinky doggy or kitty breath is a smell you might think is normal, but it can actually be a sign of health issues. Just like in humans, bad teeth and gums can lead to other health problems. As pet parents, we can do better when it comes to our animals' oral health. Lindsay Buckingham explains.
We take our pets to the vet for wellness checks and when they're feeling under the weather. But are we ignoring an important part of their health?
Over 70% of pets in the U.S. have periodontal disease by age 3 years old.
Dr. Mallory Canwell is a veterinary dentist and oral surgeon at VCA Great Lakes Veterinary Specialists. She says, overall, pet parents, we can do better when it comes to our animals' oral health.
Once we notice that bad breath, that doggy breath, we think that's normal, but it's not.
That bad breath could be the result of gingivitis or periodontal disease. Without treatment, it can lead to much bigger problems.
We need to figure out how can we stop this cycle of bad breath and inflammation and gingivitis before we're looking at loose teeth, diseased teeth with bone loss and gum loss that then we need to have a lot of extractions for.
Prevention starts at home. Dr. Canwell says brush once a day or every other day. A soft bristle toothbrush for humans works fine, but make sure the toothpaste is made specifically for them.
This is poultry flavored toothpaste, nice and yummy chicken flavor. We want it to be a treat. We want it to be a positive experience, and so, we don't want them to have human toothpaste because the fluoride would be dangerous if they swallowed that.
Bellini, a 1-year-old golden retriever, is already a pro. But you can teach old dogs and cats new tricks, as long as you make it a positive experience and go slow.
Lift the lip and not open the whole mouth to get access when doing this. And that allows you to brush these outsides of the teeth and have it be less stressful for the pet.
Food plays a role too. Dry kibble big enough that they have to chew provides great enzymatic action on the teeth. Vet-approved dental treats or toys can also dislodge plaque. As with humans, dental disease can affect overall health, especially the heart, kidneys, liver, and joints.
We want to have a healthy, comfortable, functional mouth for every pet so that then they can eat, they can play, they can give good smelling kisses, and to protect the rest of the body.
This is a medical diagnosis no pet owner wants to face. About 1 in 4 dogs will get cancer in their lifetime. Over age 10, that risk rises to 50%. It's also the leading cause of death for dogs that have passed middle age. So they're not too different from humans in that way. But what you may not know is cancer research in dogs has a direct impact on cancer treatments in humans, helping to find life-saving treatments for all of us. One of the cutting-edge treatments is electrochemotherapy, or ECT. It combines chemotherapy and electric pulse therapy. While common in Europe, it's considered an emerging specialized treatment here.
This is Metropolitan Veterinary in Highland Heights, a 30,000 square foot facility that opened in 2022. In addition to a 24/7 emergency room, the specialty hospital also offers internal medicine, surgery, neurology, cardiology, and ophthalmology. But today, we're here to talk about cancer.
The field is really rapidly evolving, and actually we're excited here to be a site for clinical trials, looking at newer therapies for treatment of various diseases.
Just as with humans, in pets, the main avenues of cancer treatment include surgery, chemotherapy, and radiation therapy. But now, Metropolitan has become the first in Northeast Ohio to offer another form of treatment called electrochemotherapy, or ECT. It boosts the delivery of chemotherapy drugs into cancer cells using short but intense electrical pulses.
What that's going to do is going to create holes in the cancer cells and allows the chemotherapy to rush in at much higher concentrations, so up to even 1,000-fold what we would get otherwise.
Your pet would be under anesthesia, but for demonstration purposes, oncologist Megan Brown is showing us on Isla, a sweet pup willing to be our stunt dog for the day.
It's a nice option for clients that can't necessarily do the standard of care, or if the tumor is not amenable to surgery, we still have options that are going to involve lower cost, fewer anesthesia episodes, and we can do it right here.
ECT can be used in place of radiation, which often involves more visits and travel time. But when it comes to deciding what's right for you and your pets, that's an individual choice, one that Dr. Brown believes should focus on quality of life and not necessarily length of years.
I'm a firm believer of treatment should never be worse than the disease. So we are really here to help maintain or improve quality of life and to never detract from it.
Effectiveness of ECT depends on many factors, including tumor type and size. Though still relatively new compared to other treatments, long-term results of electrochemotherapy are considered very good. There's still more to come on Prescription for Life Clear the Shelters Pet Edition, including how to improve the odds of finding your lost companion. But first, a warning about a medical condition that can take the lives of larger dogs. This one's a personal story. If you are a longtime dog owner, especially if you're owned by a big dog, chances are you've heard of bloat. It happens when the animal's stomach becomes distended from too much food, fluid, or gas. But in large breed dogs, there's a risk for the stomach to flip or twist. And without immediate medical attention, death can occur within hours. That's why it's important to know how to spot it and be aware of a procedure to help prevent it.
For 11 and a half wonderful years, I was lucky enough to be Griffin's human, a protector, couch companion, an all-around great dog. It wasn't old age that took him from me in 2018, but a condition known as gastric dilatation volvulus. GDV is a condition that can strike large, deep-chested dogs in which their stomach can twist on itself.
It can lead to death of the stomach, and because of the shock, it's quickly deadly, usually within 24 to 36 hours.
Dr. Sheldon Paget is a senior surgeon at Metropolitan Veterinary Hospital in Highland Heights. He says understanding the signs of GDV can save your dog's life.
One of the biggest things you're going to see is him being anxious and whatnot, and also widening below the rib cage here.
Griffin showed all the symptoms. He had pale gums, excessive drooling, rapid breathing, and non-productive retching. You may also notice your dog's head pointing to his belly. Diagnosed by X-ray, veterinarians first work to stabilize the dog, insert a tube to relieve some of the stomach pressure before they work to untwist it during surgery.
It's the most common disease that we see in the middle of the night that we take him to surgery for. 20 to 30% of those patients don't make it.
We recognized the symptoms and got Griffin into emergency care within 45 minutes. He survived the surgery, but never fully recovered. We said goodbye a week later.
These dogs that are predisposed to it, if we know they're predisposed to it, if they're having surgery for another reason, like a spay or a neuter, it's a common time for us to say, let's do something to keep this from happening so you don't have to worry about it ever.
That preventative surgery is called gastropexy. Surgeons can now even perform it via an incision from chest to abdomen or through a laparoscopic procedure.
We do it from a minimally invasive standpoint. They tend to do really well with a preventive surgery, tend to go home either the same day or the day after surgery.
That's the route we took with Fergus, who turned 5 last year, a choice we made after talking with our veterinarian. If a large dog is part of your family, talking with your vet about GDV is the first step in reducing the chance it happens to your gentle giant.
Pet insurance may cover a portion of the surgery, but make sure you check with your carrier ahead of time. And speaking of surgery, there's another one pet owners face, especially with active, big, or overweight dogs: torn ACLs. Lydia Spar shows us exactly what happens when her dog went in for the repair. But in this story, there is a little bit of surgery video, so fair warning.
It's a busy day at West Park Animal Hospital. Dogs and cats in and out all day. But then again, this is every day. Today, my dog, Lady.
You gonna be okay? You might go, girl. Don't worry, you'll be okay.
Is scheduled for ACL surgery. Dr. Kane Henderson is the veterinarian.
It's intended to pull this back, these soft tissues, and so what she tore is actually down in the middle here.
He'll perform the procedure. He says Lady tore her ACL, so she'll have a cranial cruciate ligament repair. She will require an implant.
That is essentially a spacer. Once we make this cut, we advance this piece of the bone forward, and then this implant is just simply maintaining that space.
It's time.
All right, we're all ready for Lady.
They give her something to calm her down.
It's kind of like a twilight, so she's just gonna fall asleep in here. It takes about 5-10 minutes.
And within minutes, she's out and is carried into the OR. And just like human operations, all her vitals are monitored.
Nowadays, this is literally the absolute most common orthopedic procedure that we do and orthopedic injury that we see. We're getting ready to make this cut now. We do have a decent amount of arthritis already here.
Kane says it's typical to see all this.
Really, the whole backside is completely torn. It's just the front that's still intact.
With this type of injury.
Medial meniscus, and it's actually torn and flipped forward.
Once inside, the implant is placed.
We want to see that guy hit 90 degrees.
And after nearly 3 hours, Lady is taken to recovery. While she still is very groggy, it will take Lady 10 to 16 weeks to recover.
I can personally tell you I have seen Lady in the last few weeks, and she's doing great, getting around, getting her walks in, and being the lady that she truly is and loved dearly by her mom. You hope it never happens, but sometimes a pet can get out of the house or yard and get lost. There are do's and don'ts when it comes to finding a missing pet, and one thing we should all do to help ensure they make it home safely.
We love our pets and do all we can to keep them safe, but sometimes, despite our best efforts, they manage to escape.
My own cat ran away on the day that my son was graduating from college, so in Columbus. So we looked as long as we could look, and then we had to go to Columbus.
The story of Oreo the cat has a happy ending, but it took 3 months and a Facebook page devoted to lost pets before Tracy Boyer Eisenberg and Oreo were reunited. Relief for Tracy, who isn't just a pet owner, she's also an admin for Sam the Parrot, the same page that helped bring her cat home.
It's amazing. There are over 33,000 followers now on the page, and they're really what makes it work, because they network, they're watching everywhere to match up pets.
I always tell people there are 100 different Facebook sites out there that are really, really good right now. Posting them up on social media is key at this point, tantamount to finding your animal.
Greg Willey of Friendship APL says typically animals get a taste of freedom and then panic. Cats especially will find small spots like under porches and decks or cars to hide.
A lot of these animals don't run as far away as people think. Put up signs in a couple of block radius, talk to your neighbors, talk to the people in the area. A lot of times make them part of the search.
Though it may be tempting, don't chase a loose dog. It may push them out of the area and into a more dangerous situation. Try luring them instead with treats or food outside your house. But the most important step you can take to protect your dog or cat, you have to do before they go missing.
The biggest and best thing to do is make sure your pets are microchipped. If your pets are microchipped and it's inexpensive to do, then if somebody finds your cat or your dog or whatever pet, they can take it to any vet, take it to the APL, and they can scan and get your information and get your pet home.
Other things to consider: investing in a GPS device for their collar, and always make sure they have that collar on with an updated name tag, your contact information, and phone number. It's also a good idea to routinely check your tie-outs, fences, and screens in case they want to bolt through the door or window. So now you know many of the health basics to keep your fur ball happy and healthy. But if it's time to add to your family, we hope you consider helping us clear the shelters. There's nearly 6 million dogs and cats in the nation's animal shelters desperately looking for a forever home. So please consider rescuing one, because ultimately they'll be the ones who rescue you with unconditional love. And if you're already a pet parent, play, snuggle, and walk a little longer. It's for your health. And that'll do it for this special edition of Prescription for Life. Thank you so much for watching. I'll be back with another dose soon. Until then, wishing you, yours, and your pets good health.
Thank you so much for listening to Health Yeah. Remember, you can watch the video versions of the episodes on YouTube at Monica Robbins' channel. Subscribe and follow my work and never miss an episode at author.com/Monica Robbins. Find me on X and Instagram at Monica Robbins, and I'm also on Blue Sky Social at monicarobbins.bsky.social. And you can follow me on Facebook at Monica Robbins, WKYC in parentheses. Wishing you the best of health, and stay tuned for your next dose of information.
Monica Robbins is not a medical doctor. All content presented in this program is for informational purposes only. It is not intended to be a substitute for professional medical advice and should not be relied on as health or personal advice. Always seek the guidance of your personal doctor or qualified healthcare professional with any questions regarding your health or medical condition. Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update, and find more on everything you heard right here on WKYC.com, the WKYC app, and WKYC Plus on your smart TV.